Um, Thanks to the organizing committee for letting me speak on this topic. Very important, and I hope I'm able to add something to your life with my talk today. I'm Dr. Sajili Mittal. I'm MDS in periodontics. I passed out from Maharashtra in 1998, and I have 26 years of experience. I did my MDS in 2006. I went into teaching and then finally settled into practice. I worked in Safdarjung Hospital in UK, in MCD hospitals. So finally now I'm into my practice. Oral health, which is essentially a part of our overall health. I think it is still an ignored area as far as general practitioners are concerned, but with more awareness coming in and with more dentists graduating, I think there is a lot of awareness now which is coming in. So aging is a multidimensional process, and dental tissues also undergo changes from time to time as the age advances. Going back to our textbooks of 11th and 12th standard, I would just like to revise the tooth structure. The one above the gums is the crown and one below the gums is the root. The tooth is made up of enamel on the top, then the dentine, and then the pulp, which consists the nerves and the blood vessels. And geriatric dentistry, as you're all aware, is dental care for the elderly and treatment of problems associated with age-related diseases. So mouth, as we call the mirror of the overall health, actually gives a lot of insight into the general well-being of the body, and it is an integral part of general health. In elderly population, poor oral health has been considered a risk factor for general health problems. Older adults, they generally have some form or the other of chronic illness, which does complicate the oral health eventually. So it is a separate section, a distinct group in terms of provision and care. Age-related problems are now becoming more common, and as I said, there is more awareness, so people are seeking more dental care because of longer lifespan, and there is more dental treatment available. People are able to retain their natural teeth longer, and in fact they're able to retain their natural teeth, lifelong, as long as they take care of their teeth well in time. So with reduced immune function, bone and muscle mass, and with as we age, our manual dexterity goes down, cognitive function goes down. It is more difficult to sit on the chair, osteoarthritis sets in. So as we age, taking care of our oral hygiene becomes more and more difficult. Added to this is the financial aspect. Unfortunately, in India, dental, or in fact anywhere in the world for that matter, dental insurance is not there. In a few developed countries it is there, but it only covers a part of the treatment. So it doesn't cover the entire treatment. That's why there's so much dental tourism. People from abroad come here to get themselves treated. And it is a constant challenge, for patients to come up with the money from their pocket to get their dental treatment done. Since the elderly are more susceptible to dental caries, periodontal disease, which is the disease of gums and bone surrounding the tooth. So if you ask me what is more important, is it the tooth or the bone? I would say it's the bone. Because even if you lose a tooth, we need the bone to implant, okay? You can still deal with the loss of a tooth. But if you have no bone, it is very difficult to actually give you a prosthesis. Another problem, again, due to financial considerations, a lot of people tend to hold on to their dentures. They have ill-fitting dentures, loose dentures. Dentures should be actually changed every 5 years because the bone undergoes resorption. And so once you have ill-fitting dentures, they in fact worsen your situation. So prosthesis in time is important. The oral changes with age, because you've been neglecting them from an early age and they accumulate over a period of time, They result in tooth loss, dental caries, root caries, which is the worst because root caries is actually next to your gum or under your gum, and it is really difficult to treat it because while you're filling a tooth, you need to do isolation, and when you are trying to do isolation in a caries which is below your gums, it is really difficult to fill it and to have a successful filling. I mean, there are ways and means to do it, but then you need an experienced dentist to do it for you. Dry mouth, xerostomach drugs, which the patient is on, and the salivary glands, which go atrophy over a period of time, does contribute to xerostomia. Xerostomia directly affects caries because if you do not have saliva in your mouth, which gives you antibacterial, antiviral, antibodies, buffering, it's like a lubricant, everything. So if the saliva goes down, you are prone to gum diseases, you're prone to caries. Xerostomia is also linked to various drugs, antidepressants, psycholeptics, salbutamol inhalation, diabetes, Alzheimer's, Parkinson's, and also dehydration. I might have missed a few here, but there are a lot of drugs and conditions which are linked to xerostomia, and in the elderly patients, that is one of the main things I see. And in fact, now I've started advising all my patients above the age of 55, 60 to start using saliva substitutes. Cracked lips, mucositis. It obviously impacts the patient's life because the appearance is an important thing. Chewing, deglutition, and speaking and looking good. Everything involves your tooth structure. Breaking down the food, swallowing. So it's an integral part of our physical health. Postmenopausal women, because of osteoporosis, mineralization of bone goes down, and there are periodontal problems again in such women. So what can we do, at an early age? One thing is definitely to learn the correct technique of brushing. There are a lot of problems which happen due to stress because of faulty technique of brushing. And of course, there are some which come with aging and you can do nothing about them. So if you are doing faulty brushing, if you're not brushing the correct way, if you're holding your brush at 90 degrees and just going back and forth, it is going to create abrasions in your teeth. So rectify and learn the correct brushing technique, which is to hold the brush 45 degrees to the long axis of the tooth, vibrate and move up to remove the plaque. Plaque forms every 12 months, and that is the culprit for both caries and periodontal disease. Maxilla starts growing upwards and inwards, and mandible downwards and outwards. So if you see a lot of people with aging, this area becomes smaller. The height, which we call the vertical dimension of occlusion, reduces, and a lot of people approach dentists because they want to look younger, they want cosmetic treatment, and these lines, wrinkles, they want less, which you can improve with cosmetic treatment in dentistry. But again, like ma'am said in her earlier presentation, requires a lot of counseling because there are multiple treatment options in dentistry. We have to very carefully select what is best for the patient. For one treatment, there can be multiple options. So counseling again, making them aware of what's real and what's not. Also, why dentists stress that implants should be done as early as possible, because when you're extracting a tooth, I'm only talking of implants here, there are many other prostheses like dentures, fixed partial dentures. I'm talking of implants because it has a direct impact. So when you're extracting a tooth, bone resorption takes place in that area, the ridge becomes narrower and thinner. So it is difficult to place the implant. So now what we are doing mainly is at the time of the extraction, we are placing the implant so the bone loss is minimal. So also as you age, medically you may not be so fit to undergo implants. So a stitch in time saves 9. What are the functions of the teeth? To support the lips and cheek, to give us a fuller and a more aesthetically pleasing appearance, give us a good bite, proper pronunciation and speech, maintain the height of the alveolar ridge, though some amount of physiological attrition, which is the cutting down of the teeth, does happen with age, and stress can definitely add to it. If stress is added to this, there is severe attrition that takes place, and even your temporomandibular joint can get affected with pain happening here. So with teeth missing, you also have difficulty in mastication of food, obviously the psychological impact, and reduced quality of life. So what are the practical suggestions? I mean, I've told you all the problems, but then what can we do? So I think as people age, and this is an area which still needs some development in India, I think PGI Chandigarh is now working on a project on geriatric dentistry, but it is still to be introduced as a branch in dental colleges. So an oral hygienist could visit the homes to give dental care to the elderly, which could be more preventive in nature. Developing a routine is very important. Brushing in the morning after breakfast and brushing at night after dinner. Why after dinner? Because whole night we are not talking, there is dryness in our mouth, our tongue is not moving, so there is no circulation of saliva. That is the time the microorganisms act the most. So we should, before sleeping, brushing is very important, and in the morning, most people brush, so that's not what is to be done. You need to first have your breakfast and then brush, so that you take out all the accumulated plaque and debris and food, and then when you go out to work, you have a fresh mouth. Also throughout the day, you are talking, you're eating, so there is a functioning of the muscles that's happening. Also, the instructions which should be given to the elderly patient should be very, very precise and to the point. Maybe some props can be used. There are patients who report with cataract, with cognitive issues, with other people who are going physiotherapy and other things. So just sometimes sign language helps, reassuring the patient, a gentle touch, facial expression, a smiling dentist, I think really helps, and welcoming of the old patients. These are few of the dental aids which in the elderly people are very useful and helpful. These are proximal brushes on the left side. So most people are aware that they need to brush their teeth, but they're not aware that between the teeth also they need to clean. That's why at a young age we say floss your teeth. But when you get old, the spaces between the teeth generally increase if you've had periodontal disease. So what you would do is use these interdental brushes. If you see they're at an angle, you have to introduce it between your two teeth, and that's how you clean between your two teeth. Brushes should be really soft. Most people with periodontal disease think they need to brush really hard and they should use hard brushes, and that's how they end up with toothbrush abrasions. So a really soft brush, and if possible, a short head brush which can go around your last tooth and can clean each and every tooth. So when you are brushing, you need to do 7, 6, 8, 7, 6, 5, 6, 5, 4, 4, 3, 1, 4, 3, 2, like leave one tooth from behind and keep progressing. 45 degrees, I'm repeating again, to the long axis of the tooth. Vibrate, do not move it back and forth, and then just slide it down, inside and outside. One of the good interdental aids is also the oral irrigators. This gives water pressure at an angle of 45 degrees again, in a pulsating pressure. You can keep this on the medium or the low setting, and this is a substitute for flossing, because a lot of people find flossing hard to do. Thank you.
Honestly, very nicely explained. Basic outline बहुत अच्छी तरह आपने बताई. The only thing I, as a practitioner, would like to add, since people with old age have reserve money for other treatment apart from dental, cover from insurance side or from the government side or from NGOs or wherever possible should be there for the patient to spend on the dental health also, which is usually neglected.
Yeah.
If that thing is possible for the patient, it will be a great advancement, because people prefer not to spend on their dental health and spend on any other thing that's possible. Lifestyle, yes. Medical, yes. But dental, no. That is one thing that is actually there that we need to add as the age of the patient increases, and that should be done from the government or NGOs or wherever possible. People prefer not to spend their own money.
Exactly, to support the elderly.
To support them. And the other thing, hygiene habits taught at a younger age is the
Right.
most beneficial thing.
Exactly.
Usually people neglect that.
Yeah, so generally people don't bring their children to the dental
Exactly.
clinic. ये तो दांत गिर ही जाएंगे. But
Right.
that's when you inculcate the habits.
Good
That's
habits should be
important.
introduced early. That's it.
Thank you. It's very interesting because dental hygiene, I think you guys are really right that it needs to come from a younger age. And the first time I went to a dentist was when I was 33, right? And then I got to know that my teeth are aging suddenly after many years. So it's a very point well taken, and I thank you both for being part of this ceremony, for being a part of this event. I would like Dr. Pushkar to present a little token of appreciation, please. Thank you.